This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko from the Acupuncture on Air show, where every Tuesday we talk about acupuncture and how it can help various conditions. Today we're going to be talking with Mana Fleming from Christchurch. How are you, Mana?
I'm good, thank you. Good morning, everybody.
Yeah, your last show was good. I had a lot of interest there with the people in Tai Chi, and surprisingly, we've even had some calls up here asking where to do Tai Chi in the Hawke's Bay. So you'll have to come up here and start teaching.
Yeah, wave my hands around a bit up there, eh?
But today is a particularly interesting topic for me because I have a specialist interest in it, and my understanding, which I like, because you have a specialist interest in too, is talking about acupuncture and post-concussion syndrome.
Mm.
And I mean, this is one of these conditions where I know it works. And my patients, they're very happy and they can feel it doing things. But, of course, science will say, it's all in your head, you know.
Yeah.
But, Mana, why don't you first just tell us about just some of the main symptoms associated with post-concussion syndrome?
Well, generally there's headache, the memory gets a bit fuzzy, often there's poor concentration, sometimes there's dizziness. And then there's a thing that I read just as I was checking things out, that in the Chinese type diagnosis there's a thing called Shen Shi Huang Hu, which means abstraction of the spirit, which means the spirit's not present. So that kind of may lead to things like depression or flatness, apathy or anxiety.
No, that's because my experience with the patients that I've had with it, particularly tiredness is a big one, the headache is a big one, but also the inability to concentrate, and that probably comes in that what we call that spirit disharmony in terms of traditional Chinese medicine. And I mean, I know the tiredness just comes about because, you know, people are fighting their mind to try to think, to try to do something. Everything then becomes a struggle for them. And interesting, as I had a patient during the week, actually last week, and she sort of explained it like this, where she said that she went into a cafe with like three friends, and she's done that 10,000 times, and then she's in the cafe, and then there was the noise of the other people, there was the music that was playing in the cafe, and then, you know, hearing the coffee machine going, and then it just like completely exhausted her, it overwhelmed her, and then she said like her brain just felt like this fog, and it was like there's this mist with all these people that she was sitting with, and she just said that, and she just had to leave. She's just like, I just can't handle it here, and that then really then of course then stresses her out more, and then particularly she, well, you know how can I go back to work, and being a school teacher, and when she just at this stage she just can't. So well, what about you? How have some of your patients described, you know, their post concussion syndrome?
Well, sometimes they don't describe it at all because some people think they're fine.
Right.
And so I kind of observe that our perceptive reality shifts a bit. So quite unusually, I often ask people with post-concussion syndrome to let me be the judge of whether they're better, which is quite a big call for me because I tend to be very focused on what the patient wants, but often they can't, or some that cannot tell that they're off balance. And then you'll get the others that truly know, and it's really the tiredness and the overwhelm, and they just, as you say, have to leave or change environment to calm it all down. And as you were talking, I was kind of thinking it's almost like there's a protective barrier in the brain, and it's called the reticular activating system, and that sometimes I think when we get a trauma to the head, that it's like the doors stay open and everything comes rushing in, and we don't quite have the ability to open and close the doors on our own.
That's a good way to look at it.
Yeah.
And I know that as colleagues and Chinese medicine practitioners, we sort of understand how Chinese medicine can help concussion. When we know our meridians go into the brain, and then you treat damp and treat the spirit and all this, but it's actually explaining this concept to patients. So, how do you try to explain it to them? Like, why does acupuncture help this condition? Or how does it help it?
Yeah, I kind of say to them that when you get a head injury or a trauma like that, sometimes it's a little bump. And actually the interesting thing, Heiko, that I think a lot of people don't realise, that sometimes if we fall heavily on our butt, that can also give us a concussion, because the spine gets disturbed and then that rattles the brain.
Yep.
So sometimes we don't even need a blow to the head to actually get concussion. It's a strong landing on the pelvis. I often say to them it's like they're a little bit beside themselves, that part of their protective system has kind of stepped out of their body and left them really vulnerable, and I just kind of explain that it's acupuncture's job to pull them completely back into their body again to help create wholeness, and it's a process that they're in charge of, and that I think it's important to go slowly and cautiously, because often that blow or that shock, the person doesn't feel in control anymore.
Okay, very good. I like that. That's good.
Yeah, so I often just say the injury is often quick and traumatic, so let's do the opposite to treat it. Let's go slowly and cautiously.
Now, another question that patients often ask me is that, or do I put needles in the head? And they say, well, and will that help? Because you're obviously not sticking needles into the brain, but
no.
so the question is, do we stick needles in the head, and if so, how does it help?
I certainly stick needles in the head. Often those head points that really, really help are, I use the ones, Heiko, you'll be familiar, Shu Shing Kong and Yin Tang a lot. So they're both very calming, and I think sometimes if we're pulling somebody that's a bit beside themselves back into their body, calming the brain so it's not in a panic, helps that ability to create the mind to come together as a whole.
Yeah, the way that I've explained it to people is that, like, sometimes you have knee pain, and the pain they're feeling is deep inside the bone, inside the knee. And of course the needles are not going through the bone,
No, that's right.
They're going near the knee, but then somehow it stimulates that whole area. It's the same with the head. So then, and of course, you can't go through the skull bone, but and those you could probably try.
Good protective barrier, isn't it? Those bones.
Yeah, and then I know that also in New Zealand, I've seen a number of patients. And predominantly, it's nearly always they've been covered by ACC, because it's been as a result of an injury, but what we find is a bit frustrating is because, like, ACC will pay for a certain number of treatments, and then it's sort of it stops per se. But then they'll keep paying for a whole lot of what I call the other treatments. And often patients will say, it's so frustrating, ACC is making me do all these things, and they'll pay for me to go in a taxi for 20 minutes and see some therapist, and then I look through a square hole on a round piece of paper, twisting my head from left to right. It actually makes me feel dizzy and sick and tired, and then you finish this assessment, and then they conclude, you've got concussion. And it's like, well, I know I've got concussion. I actually want to do something about it, you know. And it gets quite frustrating that, we could have with the government some kind of funded centre, where an acupuncturist is employed and you have like a multi-bed arrangement, where, and it would be very cost effective. Do you think there's any chance in the future we could have something like that, Mana, or do you think it's just we're just dreaming?
Look, I think, Heiko, personally I'd love to be involved with something like that because I really enjoy working also, with aspects of the brain and how the brain works and perceptive realities of which, post-concussion syndrome is part of that. That would be fantastic to be involved, but I just keep wondering when the mainstream medical profession would actually just get a bit innovative and stop marking their own territory. to be fair, and to have a truly client-centred approach, which actually is in the Health Act. It's supposed to be a client-centred approach, and it's just not happening for so many people. It's not allowing access for people to choose their own outcome and their own way of getting better. Of course, being advised by the mainstream medical, but there's very little opportunity, and I guess when there's truly no money left, and they might need to really cut costs, because in bureaucracy they can say, oh, we're losing money, but there's always money pouring in.
Yeah.
So there's never really that discomfort of actually not being able to pay a bill. They just pay it on the next financial year. But when we truly get to that point, they may have no other option than to actually get way more innovative and actually include Chinese medicine, which is regarded by the World Health Organization as a legitimate medical model and is included in their paperwork as a legitimate medical model. So, yeah, we just
speaking
kind of
about
wait.
Chinese medicine, of course, Chinese medicine also involves Chinese herbs.
Yeah.
Now, do you want to just tell us a little bit about some Chinese herbs and how they that they may affect or help for concussion?
Yeah, sure. So generally when you get a head impact, or even that one where you sit on the butt, the blood kind of stops moving. Most often, it's the blood stops moving, so you get kind of what we call blood stasis, which is a very full condition. So it can actually give a more extreme outcome, where the tiredness is actually more. Even the frustrated emotions are more, even the flat emotions are more, it's like more pronounced. Mm-hmm. So in that, it just means the blood stops stuck or it congeals a bit. So the job is to kind of create free flow. And, in some cases it's free flow of, your change of smell might change, your hearing or your sight, your taste maybe. And there are herbs that can really help with moving that blood. And three that come to mind are, I like the one Chuang Xiong,
yep.
Yeah, but there's, up to the head and sort of what we call resolve stasis, like that, I believe, it sort of smooths the blood and dissolves any congealing. Daorin and Hong Hua, are two others that go together just beautifully to do all that. And then there's one that came to mind. It's not necessarily a blood mover, but, to move the blood in the body, we need the qi to move. And the one that came to mind that I would probably use is Nanjing.
Yep. Yeah, I'm always a bit hesitant though, sort of, recommending herbs per se, like on a forum or something like this, because then
that's right.
People just say, well, they'll just rush out and buy those. But I just do want to stress to the listeners is that like these few herbs that we've mentioned, they're often, they'll be part of a complex formula that will be tailor-made individually for the person, because everyone's different. Some people, have liver problems. Some people have stomach problems. Some people have good digestion, bad digestion. So, the other herbs are all added to modify so you can actually assimilate or process the action of those specific herbs more effectively, as opposed to just, one herb for this and one herb for that.
That's
so,
right.
So that's why I do want to stress that, so that...
I agree. I think it's important to know that in Chinese medicine it's personalised, so, just one formula doesn't fit all.
Yeah.
And that's actually why I use the Chinese names.
Yeah. No, they'll be ringing me and to say, well, where do I get these funny Chinese name herbs from?
And you'll be able to say, come in and I'll make you a formula.
Yeah. I'll tell them to ring Mana. So, so that's quite clear. So I think we're getting across to time now to wind up the show. But just very quickly, that the next time that we talk, I know we're going to be talking in a couple of weeks' time again. And we're going to be talking about a topic, and it's basically going to be titled "Lurking Pathogens."
I know,
and I know this will be interesting.
Mysterious.
And Ken's looking at me quite bewildered, sort of, what the heck is?
I've never really seen a lurking pathologist. Have you?
Yeah.
Oh, they lurk.
Do they really?
We'll be talking about lurking pathogens in a couple of weekends. So. Mana, again, thank you for coming onto the show, and we look forward to you again in a couple of weeks.
Yeah, I look forward to that also.
Yeah, and just to finish the show, there can only be one song, and that's "Brain Damage" by Pink Floyd. So here it is, and we'll see everybody in a couple of weeks.
Yep, happy days.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.